The human heart, it's one of the most vital organs in our body, beating tirelessly, pumping blood and oxygen to every single cell, keeping us alive every moment of our lives. For centuries, doctors believed that operating on the heart was impossible. The idea of taking a human heart out and replacing it with another seemed like something straight out of science fiction. But in the 20th century, medicine took a bold leap forward. In 1967, a historic event changed the world forever: the first successful human heart transplant surgery. This groundbreaking operation didn't just save a life. It opened a brand new chapter in medical science. In this video, we're going to dive into the incredible story of that first heart transplant, the brilliant minds who made it happen, the patient who received the new heart, and how this medical miracle transformed modern healthcare. For thousands of years, the heart wasn't just seen as an organ. Ancient civilizations believed it was the center of emotions, intelligence, and even the soul. Because of this, doctors were extremely cautious about even touching it. Until the early 20th century, any surgery on the heart was considered far too risky. A single mistake, a small bit of damage, could mean instant death. Even the idea of stitching a wound on a beating heart was seen as an impossible task. But as technology began to advance, a few brave doctors started to challenge these age-old beliefs. The 1940s and 50s brought major breakthroughs that completely changed cardiac medicine. The invention of the heart-lung machine was a game-changer. This amazing device allowed doctors to temporarily stop the heart during surgery while keeping the patient alive by circulating and oxygenating their blood. This made open-heart surgery possible for the first time. Surgeons began repairing damaged heart valves and correcting congenital heart defects. As their confidence grew, scientists and surgeons started asking a daring question: if we can repair a heart, could we actually replace it with another one? Before even thinking about a human heart transplant, doctors had to experiment with animals. Throughout the 1950s and early 1960s, surgeons successfully transplanted hearts in dogs, managing to keep them alive for several days, sometimes even weeks. These experiments proved that, technically, heart transplantation was possible. But a huge challenge remained: the human immune system. Our bodies are designed to attack anything foreign, and that includes transplanted organs. This process, called rejection, was the biggest hurdle. Despite this massive obstacle, one surgeon was determined to be the first to try. His name was Dr. Christiaan Barnard. Barnard was a South African heart surgeon born in 1922. He studied medicine in his home country and later trained in heart surgery in the United States. During his training, he became fascinated with organ transplantation and the new immunosuppressive drugs that could help reduce organ rejection. Barnard was known for his confidence, his ambition, and his willingness to take risks. By the mid-1960s, he believed the world was ready and that he was the man to perform the first human heart transplant. The patient chosen for this historic operation was Louis Washkansky, a 53-year-old man suffering from severe end-stage heart disease. He had already survived several heart attacks and was close to death. Washkansky knew the surgery was incredibly risky and had never been successfully performed on a human before. Still, he agreed to the operation. He understood it was his only chance to live. The heart donor was a 25-year-old woman named Denise Darval. She had been in a tragic car accident in Cape Town and suffered fatal brain injuries. Her heart, however, was healthy. With the permission of her grieving family, the medical team decided her heart could be used for the transplant. At that time, the concept of brain death was still very new, which made this decision ethically complicated. But the medical team, led by Barnard, proceeded with immense caution and care. Then came the day, December 3, 1967, at Groote Hospital in Cape Town. History was about to be made. Dr. Barnard and his team of surgeons worked for over 5 intense hours. They carefully removed Louis Washkansky's diseased heart. Then, with painstaking precision, They implanted Denise Darval's healthy heart into his chest. The entire operating room held its breath. The moment the new heart started to beat inside Washkansky's chest was nothing short of extraordinary. Against all odds, the surgery was a success. After the operation, Louis Washkansky regained consciousness. He was able to talk, to eat, and even to smile. For the very first time in history, a human was living with another person's heart beating inside their body. But the journey was far from over. To prevent his body from rejecting the new heart, doctors gave Washkansky powerful immunosuppressive drugs. The problem was, these drugs weakened his entire immune system, leaving him extremely vulnerable to infections. Sadly, just 18 days after the surgery, Louis Washkansky died from pneumonia. His immune system was too weak to fight off the infection. Although his survival was short, the operation was still hailed as a monumental medical breakthrough. The transplanted heart itself had worked perfectly right up until the end. The world reacted with absolute amazement. Newspapers, television, and radio stations all over the globe covered the story nonstop. Some praised the surgery as a modern miracle, while others raised serious questions about the ethics of organ transplantation. Religious leaders, scientists, and philosophers debated whether humans should be replacing vital organs. But despite the controversy, one thing was crystal clear: medicine would never be the same again. After that first heart transplant, surgeons around the world were inspired to perform similar operations. In the beginning, survival rates were low, mostly due to organ rejection and infections, just like what happened to Washkansky. But then, in the 1980s, a new, powerful drug called cyclosporine was introduced. It was much better at preventing rejection without completely destroying the immune system. This drug dramatically improved transplant success rates. Patients started living for years, even decades, after receiving a new heart. Today, heart transplantation is a well-established medical procedure. Thousands of heart transplants are performed every year worldwide, saving lives and giving people a second chance. Many patients go on to live long, active lives. Modern technology, better surgical techniques, and improved medications have transformed what was once a risky experiment into a life-saving routine. That first heart transplant also forced society to confront important ethical questions that we still discuss today. What is the true definition of death? Who should be eligible to receive a donated organ? How can we make sure organs are allocated fairly? These difficult questions led to the development of strict medical and legal guidelines that govern organ donation and transplantation all over the world. Dr. Christiaan Barnard became an international celebrity overnight. But more importantly, he inspired generations of doctors, surgeons, and researchers to push the boundaries of what's possible. The first heart transplant proved that the impossible could become possible through science, courage, and relentless innovation. So the story of the first heart transplant is more than just a medical experiment. It's a powerful symbol of human determination. It showed that with knowledge, technology, and sheer bravery, medicine can overcome its limits. From that historic day in 1967 to the modern transplant centers we have today, millions of lives have been touched by this incredible achievement. It's a story that reminds us that progress often begins with one bold step and a single heartbeat that refuses to give up. Thanks for watching. If you found this story as inspiring as I do, please hit that like button and subscribe for more incredible stories from the world of science and medicine. See you in the next one.